depth than that, that would be helpful.
Can I just ask, is OCDEL a branch of the state government, the local government? What is it?
Yes, it is a state office.
State office.
Yes.
That's all I had, yeah. Okay.
Does the operating agreement have any financial amounts attached to it?
No, these are for waiver services. So, and early intervention services are entitlement services. And what that means is that the waiver services fund for those services no matter what has been recommended and approved for that child. So if they meet the eligibility criteria for that service, then the waiver funds through the state pay for those services. So there would be no funds that we would be looking for county assistance with the early intervention waiver services.
Okay. Seek a motion to adopt those changes.
I'll make a motion to adopt the agreement as presented by the director.
And I'll second the motion.
Okay, it's been moved and seconded. Comments, questions? Hearing none, all in favor, please indicate by saying aye.
Aye.
Aye. Opposed, same sign. So moved. Did you have an additional comment on that?
I was just going to say there is a signature sheet, so I think I'm sure.
We actually have
Or
it.
have that? Okay.
We already did it.
We're all
Thank
set.
you, John.
Yep.
Thank you. Okay.
That's Dawn again. Yes.
Okay, the second item is presenting the Lebanon County Human Services Plan. So this is an annual plan that is required by the Department of Human Services, and it requires that we complete and report on how we utilize the Human Services block grant funds that we receive every year. This is a collaborative effort between multiple departments for the Human Services Plan and those that are funded. So it would be collaborative between Lebanon County Mental Health, Intellectual Disabilities, Lebanon County Drug and Alcohol Commission, Lebanon County Community Action Partnership, and then we also have other departments that assist us with writing the plan, as we're required to talk about the cross-collaboration and how we've really utilized and collaborated across the entire county to deliver services and supports to the individuals that we serve. The guidelines from the Department of Human Services were distributed on May 21st. And they give us 60 days to accomplish all of our tasks and submit that document to the Department of Human Services. So we then completed 2 public hearings. The first was on June 23rd and the second was on June 30th. And the final document, the draft document that you have before you today, is 84 pages. It is a rather large document. 47 pages are for the mental health program. The Office of Mental Health and Substance Abuse Services has quite a lot of requirements for the mental health program, and then the remaining pages would all be for intellectual disabilities, substance abuse, also the homeless assistance program, and then the Human Services Development Fund.
In simple terms, can you just explain because you've been here through the transition from when we were silo funded to the block grant, how that's benefited some departments that we're a little short?
Yes, absolutely. So what this affords is that the funds that are put into the block grant funding stream are really able to be shifted from one department or one program to the other. So over the years that we've been involved in this, we've been able to use some of those, what would typically have been retained earnings or had been given back to the state. We've been able to use that for other programs that were running a deficit and didn't quite have enough for all the services and supports that were used. So it's really shifting those monies around to meet all the needs. I will say that not for every department, not all the services and supports that they deliver are through the block grant funding, so it may be a portion of the funds that they've received. But it has been a tremendous assistance to Lebanon County, and having that flexibility to really move and shift those funds where they are needed to really meet all the needs of the individuals that we serve in the county.
Thank you.
And that helps to treat the whole person if they have a dual diagnosis in drug and alcohol, mental health, whatever, or ID, And so it can go between departments as well.
Absolutely. Yes, and it also affords the opportunity that if we should have a surplus of funds, then it allows for the ability to plan for the utilization. So we're able to plan for perhaps starting up a new service or expanding or enhancing something that is already in existence. So it really has been quite a tremendous help, and we really do appreciate being part of the block grant.
Very good, thank you. Take a motion, or do you have more to explain?
I was just going to ask if there are any questions about the large document.
I will make a motion to approve Holly's human services plan that was presented.
I'll second the motion.
It's been moved and seconded that we approve the Lebanon County Human Services Plan for fiscal year 21-22. Any discussion required? Any questions?
How much is the block grant?
So let's see, in total would be, it's roughly about $6 million that is part of the block grant funding.
And is this the first year that you're dealing with it in this form, or is this the second, or what? How long has this been this way where you could?
I was the president of CCAP, and this was my feature program to get through when we lobbied the legislature. So it's been, I think, 2012.
Well, the block grant didn't get approved until about,
Right.
I'm going to guess 4 or 5 years ago.
Okay, well, that's what we pushed
5
them.
years.
Five.
This would be year number 5. The first year, we were really just trying to understand what the block grant afforded and kind of get our feet wet and organized between all the departments. So yeah, yes, it has been 5 years that we've been part of the block grant.
Is it a mouse or something, or what?
In the
It's our low-tech offerings here.
We need new
This
microphones.
is
Yeah.
illegal microphone.
within the past year, you know, I know that earlier in the year when coroner, the county coroner, and others have presented the suicide report and all the different things. Have you found that you needed to shift more money towards substance abuse, and certainly during the pandemic, where we're now seeing, and there was just a report out today that overdose deaths skyrocketed nationwide, primarily opioid overdose deaths. I mean, have we seen that locally as well, and where you needed to shift funds to address maybe increased substance abuse?
Not to date. So typically what we do is at the beginning of the fiscal year for the block grant funds, we start with the same allocations that we would typically have for each department. And then as we progress through that fiscal year, then we are meeting every other month to review where we are as far as funding and where the real needs are. So I can tell you that for this previous fiscal year, 2021, we did not need to shift any additional funding to the Drug and Alcohol Commission for substance use. The allocation was sufficient for all the services and supports that were needed for substance use. I will say, though, that they did have a rather large number of overdose deaths, and I know that that was a very large focus for the Drug and Alcohol Commission.
And that department itself had increases in funding,
Yeah.
aside from the block grant.
Okay.
Just the allocations increased from the state.
Which acknowledged what you brought up in
Yeah.
terms, yes.
Okay.
Yeah, so I guess to answer the question, it didn't need to come from the block grant because it came from elsewhere.
Okay.
But there's only so much capacity locally too, I mean, to deliver the services. I mean, you can flood with more funding potentially, but you can only deliver so much with what we've got capacity for. So, but no, the block grant didn't move around for DNA.
Moved and seconded. Any other discussion, questions? If not, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign, so moved. Thank you.
Thank you very much.
Yeah,
Thanks,
Thank you, Holly.
Danielle has her first appearance. Come on up.
Sitting way in the back.